I am Dr. Ramnarayan, consultant functional neurosurgeon in Chennai. I operate in many cities inside and outside India, and I focus on functional neurosurgery, which, as I mentioned earlier, deals with surgery for impairment of brain, spinal cord and nervous system functions. So today I will be talking to you about a surgery called intrathecal drug delivery system. As you all know, we have what is called as a CSF circulation, that is cerebrospinal fluid circulation. That is, there is a fluid which is produced in the brain, which comes down into the up to the lower end of our back, and then goes up and it gets absorbed. This is what is called cerebrospinal fluid, and this is very necessary for the brain to have a good environment. It actually keeps the brain hydrated and all that. So the advantage of this circulation is that if you want to give a drug into the brain, you just have to give it in the lower back and it will reach the brain. We don't have to inject directly into the brain because that has got a lot of risk and other problems. So we directly put the drug into the CSF, and the CSF will take it along its circulation. It will take it into the brain. So that is the principle of this surgery. So where are the conditions where this surgery is useful? Usually there are two conditions where this is useful. One is what is called chronic pains, and second is what is called spasticity. Chronic pain, as you all know, is a pain for more than 6 months duration, and it usually affects a lot of individuals. The most common chronic pain conditions which are seen or which are really distressing are, one is what's called cancer pain, that is pain following a cancer, and second is what is called failed back syndrome pain. Cancer pain, it's one of the miseries of life. Patients who have end stage cancer are told that there is no more treatment possible for you, surgery is done, radiation is over, multiple doses are over, chemotherapy, all schedules are given, but then the cancer starts spreading to various parts of the body like the spine and the other organs where it causes the pain. So then the patient also knows that he has only very little time to live, and then that also causes depression, and depression always leads to pain. So together, mentally and physically, the patient gets severe amount of pain. This is really uncontrollable and affects the quality of life of the patient. And this is very important because the patient may be a young patient, he may be having so many social responsibilities. Because of the pain, he is crippled, so he cannot do anything. So he is practically homebound and cannot do anything, whereas he has a lot of things to settle before the God Almighty calls him back. In such a scenario, usually nowadays what is being done is people are giving him tablet morphine. But then tablet morphine, as you all know, has got a lot of side effects and significant addiction and other liabilities. So most of the patients, instead of taking the tablets, rather suffer silently because the side effects are worse than the pain in many patients. In fact, it's a patient's own words. The tablet that we take in actually goes from the stomach to the spinal cord and the brain, where there are the pain receptors, and they act through the pain receptors in the brain and spinal cord. So what do we do here? Here what we do is we put a pump under the skin of the lower abdomen, and through a catheter again which is under the skin, and this catheter is put directly into the spinal cord and the CSF. And morphine is filled up in this pump, and this pump delivers the morphine into the spinal cord and the brain. The advantage of this pump is that it requires only very minimum doses of the drug. So naturally the side effects like tolerance, constipation, addiction, all this does not happen. And the pain management is continuous because this pump works continuously 24 hours a day, 7 days a week. It is easy to refill. Refilling is an OPD procedure lasting about a few minutes, and as I said earlier, the dose is very less, so the tolerance is also very less. This is an internationally approved surgery especially for cancer pain. The other drug which is used in this pump is what's called baclofen. Baclofen is, as most of you might know, is a muscle relaxant. And there are some conditions, especially neurological conditions like cerebral palsy, spinal cord injury, some neurological conditions like multiple sclerosis, stroke, all these conditions, there may be either both legs may be affected, both hands, all four limbs may be affected, that is both the hands, both the legs may be affected, or one side limbs may be affected, that is maybe right leg and right hand or left leg, left hand, like that. So in these conditions, if you give morphine through, if you give baclofen through this pump system, as I said earlier, we can control the stiffness and the patient can be made to be mobile. In fact, many patients who have either paraplegia means both the legs are severely paralyzed, or in patients with stroke where one side hands and legs are affected, especially the hand is very stiff like this, you cannot move the hand. These patients and all do tremendously well with this pump. The most important thing is about this pump is, suppose a patient comes to us today, we just don't operate immediately. We do what's called a trial stimulation, a trial injection. That is, morphine or baclofen we put based on the body weight, 1 ml or half ml or whatever it is, into the CSF and see whether the patient will benefit from the surgery or not. We also note whether there is any side effects because of the drug. If there is no side effects and if the drugs are, if the results are very good, then only we offer the surgery. So that is why we can claim as very, very good results with these surgeries. Again, as I said earlier, these surgeries are all internationally approved and also approved by our CGHS and other systems of medicine. So to repeat again, these intrathecal drug delivery systems are very useful in conditions like stiffness of the hands or legs or both, or in severe pain like cancer pains.